One of the other procedures that I enjoy doing and helping people out with is shoulders. There's a lot of people in this area that have a lot of shoulder problems, and one of the most common things that people get are tears of the rotator cuff. The rotator cuff is a series of 4 muscles that helps pick up and elevate the shoulder and move the shoulder. And when the rotator cuff tears, that can cause a lot of problems in picking up the arm, and sometimes actually you can even pick up the arm, but it's just very painful. And so we do certain tests to see if it's torn. One of the tests that we do is an MRI scan, and an MRI will tell us if it's torn. And there's been advances in the way that rotator cuffs are fixed. What used to happen was that we would make a fairly large incision in the shoulder, and we would tie the rotator cuff, the muscle, back down to the bone. We basically do that still, but we do it in ways that are a little bit more elegant. And so sometimes we can actually do it all arthroscopically. And in the same way that people climb a mountain, if you're climbing a mountain, you anchor the rope into the mountain and then you climb up. In the same way, what we do is we anchor some things into the bone, and we tie the rotator cuff down to those anchors, and it seats the rotator cuff right on the bone. And so we can put those anchors in arthroscopically, and then there's been some new techniques with different patterns of the anchors that make the rotator cuff repair more stable. Different patterns, what they are called double row techniques. And sometimes we can do those arthroscopically. Sometimes I like to do them with a little small incision because we can see to make sure that we've got the whole footprint of the rotator cuff fixed nicely down. And the anchors tend to work extremely well, especially the newer double row techniques, because there's so many different points of anchoring the muscle down that they tend to fail less. The most common reason people come is either they have severe pain when they try to pick up their shoulder, or weakness, they're not able to pick up their shoulder. And so a lot of times we can treat some of that stuff conservatively, meaning without surgery. And so most of the time a patient comes in with that, we'll often try an injection into their shoulder. And I'd say that probably helps about 80 to 90% of people, and they often don't come back because they're better. If the injection doesn't help, then a lot of times what we'll do is we'll get an MRI scan. And an MRI scan is a high-tech test where we can actually see if the muscle is torn off the bone. And if the muscle is torn off the bone, or the tendon is torn off the bone, that's a rotator cuff tear. And those are usually nowadays treated more surgically than not. Because if they're not treated surgically, what happens is the tendon tends to retract more and more, and then the bone starts to elevate up, and then the top of the humerus, the ball, ends up banging into the top of the shoulder blade, called the acromion, and that ends up causing a lot of arthritis, and that becomes very difficult to treat. So we're fairly aggressive at fixing rotator cuffs that are torn. I mentioned earlier about some of the blocks that we're using. In the shoulders, we use the blocks as well, and it really helps with the postoperative pain control. The shoulders are done at an outpatient surgery center, and so people get blocked before the surgery and get really good 8 to even longer hours of postoperative relief. And there's a whole thought process in that if you block somebody preoperatively, then you block the initial pain that it's not really felt. Whereas under general anesthesia, the body still feels the pain, it's just that your brain is asleep. The thought being that if you block the initial pain by blocking the shoulder before the surgery, that you have less pain postoperatively. There's sort of a theory on that. And so we do a lot of preoperative pain blocks for this. And so it's not that painful, and a lot of people are in a lot of pain for a long time with these rotator cuff issues. And I just saw a patient today. I operated on her about a week ago, and almost no pain. A lot of them have no pain. Once you fix that, they have some incisional pain, but after a day or so, it's not that painful.